Hello, my name is Dina Reeves, and I assist Dr. Pennington and Dr. Touliadis by providing potential candidates with behavioral health support. I have over 20 years of experience in patient care and mental health support. I'm an avid believer that everyone should be your best self. Weight loss surgery is a life-altering, potentially stressful process and procedure that requires careful consideration by the patient. Changes occur both emotionally and physically. Weight loss surgery is not a cure-all. Instead, it's a tool to help you achieve a healthier weight. I want you to be as successful as you can with your weight loss surgery. In order to have a successful long-term outcome, it is necessary to make numerous permanent changes in your lifestyle. You'll need to permanently change your behaviors, your eating habits, and your activity patterns. I will meet with you prior to scheduling your surgery for about an hour, and I will assess your eating habits, your stress factors, your coping patterns, and your lifestyle behaviors. Based on our discussion, I can make an individual recommendation to build upon your strengths and help you address challenges so that you can be your best self and lose the weight and keep the weight off. Following your surgery, I will meet with you to provide additional support, stress management skills, assertiveness building, emotion management, and assist you with the social adjustment of your new lifestyle. It is my desire that you have a better quality of life after your surgery and recovery. I hope you will attend the seminar and discover what many people in Birmingham, Alabama already know. Advanced Surgical Weight Loss Center cares about you and will be there every step of the way.
Hello and welcome to Advanced Surgical Weight Loss Center. My name is Pam Williams. I'm one of the nurses here at the center. You'll be receiving a packet of paperwork in the mail, or you may download it from our website. It is very important that all paperwork be completed prior to your appointment. Our physicians will be unable to see you if your patient history is not completed and brought with you to your first appointment. You will spend approximately 20 minutes with the physician discussing your past medical history and the surgery that you might be considering. After seeing the physician, you will sit with one of our bariatric coordinators who will give you a binder designed for you based on the type of surgery you will be having. This binder will need to be brought with you to all of your future appointments, as additional information will be given to you. The coordinators will also help you with scheduling appointments to see our dietitian, fitness trainer, and behavioral health staff and help you with your insurance needs. Our nursing staff will work very closely with you throughout the entire process. We have been trained to perform lap band adjustments if that is the surgery that you have chosen. Therefore, you will not have to wait to see the physicians in the event a simple adjustment is needed between your normally scheduled appointments. We look forward to working with you and your journey to use the tool that we can provide you to help make a lifestyle change and give you a much better quality of life.
Now that you've heard about the surgeries, my responsibility is to let you know what all you will need to do and be prepared for when you come into the office. The very first thing that you will need to do is to take out your insurance card, and on the back of your card there is a 1-800 number. You need to call your insurance company to find out whether or not you have coverage for weight loss or bariatric surgery. All insurance companies allow employers, based on the size of their company, to write their own plans, so you may or may not have coverage for bariatric surgery. After you find out that you do have coverage for surgery, you need to find out what the requirements are, and all insurance companies have them. One of the biggest requirements is a 6 consecutive month diet that a primary care physician or someone who's been following you will place you on. It has to be 6 consecutive months within a 12-month time span. It will actually work out to be 7 visits for going to the doctor. What you will need to do is visit your doctor once a month. He will generate an office note stating that you are on a diet for weight loss surgery. He will document your height and your weight, and then those office notes will have to be brought here to our office to your bariatric coordinator, who will file those with the insurance company to get a positive determination that you will be covered for your surgery. They all also have a medical record requirement. This would be either 3 or 5 years of medical record documentation that you have had a weight problem. If it's a 3-year requirement, we want 3 office notes. Please do not bring us 36 office notes. If it's 5, we will need 5. If you are a Medicare patient using the red, white, and blue Medicare card, please do not call Medicare. They will only tell you that they will cover your surgery if it's deemed medically necessary. And they do not decide whether or not something is deemed medically necessary until after you have had the surgery. Our bariatric coordinators and our billing office here will fight with Medicare to make sure that you are covered for your surgery. After viewing and understanding all 3 segments of this online video, you will call our office at 205-716-6120 and use the phrase that is being shown to you on the screen at this time of lifestyle change. One of our front desk receptionists will be happy to schedule your appointment at that time with either Dr. Pennington or Dr. Touliadis. When you come in for that visit, you will be responsible for paying your office copay for coming in to see a specialist. Remember that a specialist copay is different than your primary care office copay. If you're going to have to be a cash pay patient, meaning that your insurance does not cover your surgery, the cost of your first visit will be $200, and that will be due at the time that you come in for that first visit. We are very proud of our comprehensive program here at Advanced Surgical Weight Loss Center. I now want to tell you about the program itself. We have 3 well-trained professionals that will work with you through this entire process. We have our dietitian, Caitlin, our fitness trainer, Miranda, and our mental health professional, Dina. Please do not be alarmed when you hear mental health professional. She is such a well-trained individual and will work with you to help you understand this lifestyle change that you will be going through after you have your surgery. In addition to seeing the dietitian, the fitness trainer, and the mental health professional, you will also be introduced to your bariatric coordinator. They are Heather and or Margaret, depending on which physician that you see. These 2 ladies are going to work very hard for you in talking with your insurance company and getting you approved for surgery. In utilizing the program, unfortunately, insurance does not cover those fees. So we have a program fee that you will be responsible for paying of $300. When you come in on the day of your first visit, if you choose to pay the $300 program fee in full, that will be fine. But if you are not able to do so, a down payment on the program fee and signing a payment arrangement will need to take place. The program fee does have to be paid in full by the time you go to surgery. What the program fee covers is unlimited visits with all 3 of the professionals preoperatively and for up to 6 months after the date of your surgery. If you will recall, we talked about someone having to be a cash pay patient. This means that your insurance does not cover you for bariatric or weight loss surgery. We've negotiated a comprehensive fee that includes the surgeon's fee, the hospital, and anesthesia. If you're going to choose the lap band surgery, the total cash pay price is $13,400. If you're going to have the gastric bypass or the gastric sleeve, the total cash pay price is $14,300. Please remember that these fees cover the surgeon, anesthesia, and the hospital. They also cover 6 months of follow-up visits after your surgery. Additional expenses will include your preoperative diet. Everyone will have to go on a minimum 2-week high-protein diet in order to shrink your liver so that the doctors can see better while they're doing your surgery, and you will have a better outcome after surgery. This preoperative diet will be purchased here at our office and will be made up of a number of different products of high-protein supplements. The total cost for your 2-week high-protein diet will be $130. You will work closely with the dietitian on the choices of what you can have during that diet time. The dietitian will also work with you post-operatively to help you decide what types of products you should consume after surgery, not only with high-protein supplements, but with your mineral and vitamin intake. We're very pleased that you chose Advanced Surgical Weight Loss Center to consider coming to our program to have your bariatric surgery. We feel we have a quality program here where we will educate you and support you every step of the way through the journey that you're about to embark on. We do look forward to seeing you soon.